It's a great pleasure and great honor to be here, and I thank the organizers extremely for that opportunity. As was said in the introduction, I'm Chief Executive Officer of the Concept Foundation, which is an NGO based in Bangkok with an office in Geneva. And we've been working in the area of contraception and medical abortion for some years, and we're focusing very much on the quality of reproductive health medicines. I'd like to thank Steve Hodgin, incidentally, because in his presentation, he showed a photograph of the view from my office for 25 years at WHO, and I thought it looked very reminiscent, except the trees hadn't grown at that time. I'm just going to talk to you a little bit about what we've done, a different type, slightly different type of study to the one that's just been described by Cindy Stanton. It's a study we undertook on the quality of misoprostol products. We looked into the factors influencing quality. I'll address those. I'll tell you what we've been doing then to address those issues and some of the implications for procurement. It looks as though it starts off as moderately bad news, but it does develop into pretty good news, I think, as we walk along. You know all about the products. I'm not going to focus on this, but really in recent years, I think the thing to underline is that in many countries it has started to be used for obstetric indications, and as was stated, it's now on the model list of essential drugs by WHO for prevention of postpartum hemorrhage. About 2-3 years ago, IPAS published a desk study on availability of misoprostol and identified some 50 products around the world. And we've been looking further at that, and we think that in India, there's probably about 30 brands of misoprostol and at least 10 brands of combined mifepristone and misoprostol formulations. Some companies make them themselves, and some go to contract manufacturers. And there's at least 20, if not more, in other lower and middle income countries. But because of the proliferation of products, Genuity Health Projects decided to commission Concept to undertake this quick and dirty study on quality of misoprostol products. And so we collected samples from several countries, from Argentina, Bangladesh, Cambodia, Egypt, Kenya, India, Mexico, Nigeria, Pakistan, Peru, and Vietnam, and collected some 76 samples, of which 74 were analyzed for misoprostol content and impurities. And rather than putting things out in a nice stratified way like Cindy, I've just plotted all the points here on this particular slide to show you the dotted lines are the 90 to 110%, the normal confidence limits that a manufacturer works to for content. And just to show you that if you plot this against if you plot the actual content of misoprostol that was analyzed against the age or the date of manufacture to the date of analysis, you can see quite a mixed picture. You can see quite a few products, quite a lot of the products do fall within the 90 to 110% limits, but there are quite a lot that fall below that. And if we look at the results, 34 out of the 74 samples tested had content less than 90%, and 8 had less than 20%. And 1 year from manufacture, 19 out of 31 samples had content less than 90%, and 7 had less than 20%. And the content of some products appeared to decrease between 3 months and 1 year. And there were several products that had quite high API impurities, and it's not something I'm going to go into here. But one of the things that came out of, I'm sorry, we can't really point to the slide. One of the things that came out of the study is when we actually looked at the results of product from specific manufacturers. And the first column on the left is from one major manufacturer, and as you see, all the points, whatever the time point from manufacturer, all fall within the 90 to 110% limits. The second one is using a different active pharmaceutical ingredient, and I think I might mention, I'll come to it in a minute, both of these were packed in aluminium packages, and they stay pretty consistent through the random sampling by age. The next one also has a similar API to the number 2, also in aluminium packaging, but there seems to be some decrease in the amount of misoprostol that was in the tablets were measured. Now we'll come back to that. And the next one was making the product with active pharmaceutical ingredients from 2 different suppliers, and there were only 5 samples from this manufacturer, but 2 of them were quite low. And the third one was interesting because it turned out that it was a major pharmaceutical company, but it actually obtained its products from 2 different contract manufacturers. And the 2 points that are high there are from one contract manufacturer, and the 4 at the bottom are from another contract manufacturer. So you can see there was a difference there between the manufacturers, even for the same branded product. And I won't bother you too much with this slide, but you can see that there's a big grouping of these pink points all along the top, showing pretty good content for whatever duration of time. And then there's a blue line which shows that samples, this sort of trend, samples perhaps could be deteriorating with age. And the difference between those 2 is that the pink points were in the aluminium package. Why have you got that other line and some other ones? And they were also aluminium packaged. And I'll come to an explanation of that in a minute, because we have been since working with quite a few manufacturers on this. So the conclusions of the study was that the results show significant problems with certain misoprostol finished products when analyzed for content and purity. With a few products, misoprostol appears to degrade quite rapidly between 3 months and 1 year, and the point that one wants to make is that these would not have been detected by any pre-shipment quality control measures. But the bottom line is, and I put that in bold, there are quality products. So what are the factors influencing quality? We've done a lot of work with the manufacturers since this time, with several of the major manufacturers. And the conclusions that we came to from the study and from our discussions with the manufacturers is that the quality of a misoprostol finished product is impacted by the active pharmaceutical ingredient, how that was manufactured, whether its manufacture met good manufacturing practice, and how that was stored. Then the actual manufacturing process of the finished product itself, whether it meets current good manufacturing practices, whether adequate environmental controls are instituted during the manufacture, how the product is stored, etc. And the type of packaging, blister packaging I mentioned a little earlier. So, as I said, we have worked with several of the manufacturers, and there is evidence that appropriate environmental control at all stages of the manufacturing process and use of this double aluminium blister will prevent degradation of the finished product. And if you couple this with purchasing an active pharmaceutical ingredient of proven quality and appropriate quality assurance procedures established, manufacturers can make quality finished products. So that is basically the good news. So we've continued to do this work, and we have actually visited some 14 manufacturers. And our goal, we have a major project on trying to get products pre-qualified by the World Health Organization's pre-qualification program for reproductive health medicines. And I classified the outcomes of these visits by what we considered was the possibility of getting the products pre-qualified. And I think there are 5 products that could be pre-qualified by the end of next year, and 2 or 3 more in a year or 2 later. There were 3 companies that were not very interested in pre-qualification by WHO, and there were 3 that were absolutely unlikely to meet pre-qualification. Now, The next bit is really breaking news. I should have put breaking news across this slide because 2 weeks ago, USAID announced a new expert review panel on reproductive health medicines that will be run by WHO. And it's done this because, as you can see from the line above, we don't think there will be any pre-qualified products until the end of 2013, i.e. another 18 months or so. On the other hand, there are a group of products that are really becoming quite well established, have got quite adequate GMP evidence and have to complete some other studies before they can complete their full dossier for pre-qualification by WHO. So UNFPA has established this expert review panel, and manufacturers, to enter this, manufacturers must demonstrate adequate compliance with good manufacturing practices and a commitment to continue towards pre-qualification. And we think there are 5 products that could go through this ERP process in the next 2 to 6 months. So this is the good news. There are products there that could go through an assessment process and could become available with some degree of surety in terms of what a procurer or a government would require. So we've continued to be addressing these issues. We've been working very closely recently with VSI, and we're actually completing now a manual with VSI on best practices and technical information for finished product manufacturers. And Richard Lowe and I, Richard Lowe, who is here from VSI, and I will visit a couple of manufacturers in Bangladesh over coming days, and we will actually share this information with them. It's an almost complete manual. We're working with 2 of the principal API manufacturers to get their products pre-qualified by WHO, and in fact both of them have now submitted their product dossiers for review. This helps now in getting products, the finished products themselves. If the API has been pre-qualified by WHO, then they don't have to complete the documentation to the same extent, because they can refer to the pre-qualification of the API itself. And we're providing technical assistance to a selected group of manufacturers to meet good manufacturing practice and to submit appropriate documentation, first to this new expert review panel, and then to the WHO pre-qualification program. So my last 2 slides just sort of note some of the implications for procurement, that really to obtain products of assured quality, it must be understood that quality cannot be assessed, tested, or inspected in. It has to be built in through the whole process of manufacture. WHO pre-qualification does help minimize risk and helps procurers to have greater confidence in their procurement of products. And as I said, we're aiming to get at least 4 products pre-qualified by the end of 2013. Meantime, in order to reduce risk and avoid duplication of effort, we need to have more harmonization between procurers, and this is certainly happening in the international community and with several of the social marketing organizations, and working together to develop common policies and quality assurance practices, and basically to consider the following issues: that pre-shipment may be of little value if the product is inappropriately manufactured and packaged, and to take appropriate measures to ensure that Misoprostol finished products are sourced from a manufacturer that can show that it's got an appropriate API and appropriate other excipients, supported by a drug master file. The product is manufactured under good manufacturing practice, under the appropriate environmental conditions, and is packed in a double aluminium blister. Thank you very much.